Hi, Dr. Bragg again. Last week we talked about osteoarthritis of the knee, and today we're going to talk about cortisone injections, steroid injections. What do they do? A steroid is an anti-inflammatory, so when we put it in the knee joint, it usually helps to decrease the inflammation, and you can use this for conditions like osteoarthritis and help to decrease pain. So a question often comes up, are there any side effects to corticosteroids, the steroid injections we put in the knee? Yes, it can discolor the skin. If you're African American like I am, if you get too much, or some people, it can discolor them and give them a hypopigmented area where they lose the color in their skin right at the site of the injection. For a Caucasian person, it could cause hyperpigmentation where they have a darkened spot at the site of the injection. This doesn't happen all the time, but it could. Also, you have to be conscious of the fact that steroids can increase your blood sugar. So if you're a diabetic, you really want to pay attention to your blood sugars, as the steroids can increase your blood sugars. And over time, you can have some thinning of the cartilage if you have too many injections. So how often can you have a steroid injection in the knee? You can have several in the course of a year. I usually say no more than 3 or 4. If you have one injection and you get some relief, then you can come back in about 6 to 8 weeks and have a second injection. But if the first injection gave you no relief and you had a second one with no relief, I don't think there's any indication to keep on doing injections. Some people have to choose injections as a form of treatment because they are not a surgical candidate, or they are choosing not to have a total knee replacement. And you really don't need a total knee replacement unless you have severe osteoarthritis of the knee. Now, what is important? It is important to keep up with how many injections you're having and where you have the injections. So in my book on knockout pain for back pain, I have a good chart that you can copy if you go to that book and look inside, and where you can put the date you had injection, where was the site injection, and the doctor that did the injection. This is important information so that if you go from one doctor to another, you'll be able to tell them that I already had an injection in the knee on this date, where and who did it, so that you can keep up with how many corticosteroid injections you've had over the course of time. I hope you find this information beneficial, as steroid injections can be beneficial to treating you for knee pain, but you want to make sure that you keep up with how many you've had, and if it works, you should know immediately. This is Dr. Bragg from the Spine Orthopedic Pain Center in Norfolk, Virginia. Please sign up for the YouTube below, and I'll be back again next week with another tip for a pain-free Friday, and I'd like to wish you and yours Happy Easter.